This is Indian Country Today.
Esquili, yes, thank you for joining us. I'm Patty Thalahungva. The Havasupai Tribal Council is closing its famed waterfalls indefinitely. The tribe is located at the bottom of the Grand Canyon in Arizona, and the falls are a few miles away. The Tribal Council imposed a ban on tourism in March. Now it's being extended. The only way to get into the village and to have access to the waterfalls is either hiking down or taking a helicopter. Tourists with reservations will need to reschedule. The tribe does not issue reimbursements. Chairwoman Eva Cassone said the move, quote, is in the best interest of the health and welfare of the Havasupai people. The tribe does not have any coronavirus cases and will remain on lockdown until further notice. 400 tests for the coronavirus will be given to Native Americans living in Albuquerque. First Nations Community Health Source is partnering with the New Mexico Department of Health to offer the drive-through test. People do not need to have symptoms to receive the free tests. Albuquerque ranks 6th among U.S. cities with the highest percentage of Native Americans, according to the New Mexico Census Coalition. And as many as 400 tribes are represented in the city. The testing will take place on Saturday, May 9th. Bemidji State University is recognizing Peggy Flanagan as its 38th Distinguished Minnesotan. Flanagan is the Lieutenant Governor of Minnesota, and she's a member of the White Earth Band of Ojibwe. The award acknowledges the contributions of residents of the state who have performed outstanding service to the people of Minnesota. Traditionally, the honoree also gets to address the graduating class at Bemidji State, which this year is delayed due to the pandemic. For the latest numbers of COVID positive cases in Indian Country, let's go to Jordan Bennett-Begay, our Washington editor. Jordan?
Yate Patty, Yate Shikisto Shidine. As of this morning, there are a total of 3,800 positive confirmed cases in the Indian health system and 116 deaths. Again, that is 3,800 positive confirmed cases and 116 deaths within the Indian health system. And some of these cases came from the Cherokee Nation. They saw 2 more cases yesterday. Up in Oklahoma, the Choctaw Nation, Oklahoma, saw 4 new cases as well. And the Navajo Nation saw an increase in 95 cases on their nation and 6 additional deaths. And actually, the Santee Sioux Nation in Nebraska saw their first case yesterday on their nation. And I talked to Chairman Roger Trudell, and he did say that, despite that first case, the tribal nation did implement a lot of safety and protection measures before the state of Nebraska did. But one thing he really did say, Patty, and that kind of relates to a story we just posted this morning, is that this individual, didn't really show any symptoms that the CDC was talking about. And he started showing symptoms that were relating to a heart attack. And in this situation, like chest pain and aches. And then it wasn't until he went to the hospital and got hospitalized where they tested him and he tested positive, the individual tested positive, excuse me. And then he said, sometimes these symptoms aren't showing up in these cases right now. So they're trying to implement, to continue to tell people to keep social distancing and to keep washing their hands and following the other guidelines within their community.
So this person had symptoms of a heart attack, then went to the hospital, got the COVID test, and tested positive.
Yes, this individual, did exactly just that too. And the individual did also, come up with blood clots. So, and that just relates to what 4 Native physicians were saying in a town hall this week, that they are worried that a lot of their patients are not coming into the clinics or calling in cases where it's an emergency or, it's something that's urgent too. And they've seen a drop in cases since the pandemic has been going on.
So just really being aware of your medical state, how your health and how your body is reacting to this. Because again, even when you run out to the grocery store and you're covered up, you do risk a chance of coming in contact with the virus. So again, reminding people to limit their venture into public spaces and definitely not going into other people's homes if you are out doing the grocery shopping for your family, say.
Yes, that's correct, Patty.
All right. Well, Jordan Bennett-Begay, thank you so much.
Yeah, Patty.
We'll be right back. Welcome back. Sharice Davids is a U.S. representative from the 3rd Congressional District in Kansas, and she joins us today to talk about the CARES Act and other things related to the coronavirus pandemic. Welcome, Congresswoman Davids.
Hi, it's good to be here. I'm glad you're covering this.
Well, we're keeping close watch on the CARES Act, and you have called for an oversight to make sure that the $8 billion that was intended for tribes has a fair distribution plan. How is that going?
You know, I've been concerned about the way that the $8 billion that we were able to get into the CARES Act has been distributed or wasn't distributed for more than 30 days after we were able to pass that piece of legislation. I do think there needs to be more oversight. I do think that there needs to be, frankly, a full distribution of the $8 billion. I'm sure a lot of folks are aware that it has taken a long time. I think it comes down to a couple of different things. One is just government red tape, which unfortunately a lot of us know a lot about, but also a lack of understanding. Frankly, the Treasury Department, I would say lack the understanding of the importance of the tribal government and federal government relationship, of the trust responsibility that the federal government has to tribes. And that really led to the failure to get that money out to tribes that absolutely need it right now in a timely manner. So, Deb Haaland and I, my colleague, my freshman colleague in Congress, the two of us have been pushing really hard to try to make sure that that we're getting those resources out to Native communities as soon as possible.
Well, the definition that the Treasury Department is using that allows Alaska Native corporations to have a part of that money, how did that get into the actual legislation?
I would like to say that I know specifically how that definition got used. I will be diplomatic and generous about it and say that I think that there was an oversight and that the correction is in the works right now. When it comes to legislation that deals with Indian country or getting resources to tribes, I know I mentioned the lack of understanding earlier, but I think that having folks, although we're on the House side, really pushing and trying to clarify and make sure that these resources really need to go to tribal governments, and that the resources that go to tribal governments, one, it needs to be timely, and two, it needs to allow the flexibility for sovereign tribal governments to be able to implement the resources in the ways that they need to, because our tribal leaders and the folks who are on the ground are going to know the way to use those resources most effectively. And our tribal governments are the ones who are providing those essential services to our tribal members and to Indian country. And so when we think about the $8 billion getting allocated to tribal governments, that's absolutely where that money needs to go. We've also made sure that there's money in the bills for Indian Health Services, IHS, and urban Indian health centers, because we know that there are a lot of folks who are Native brothers and sisters who don't necessarily live on a reservation and need to access those urban Indian health centers. The other thing that we've been doing, and this kind of goes to some of the allocation of resources, is making sure that the SBA, or the Small Business Administration, uh, allows for all tribal enterprises, all tribally owned enterprises, to be able to access the Paycheck Protection Program, and I think that that's another place where we saw an oversight. I don't know if you were going to get to this, but I ended up pulling together 37 of my colleagues on the House and the Senate side, Republicans and Democrats, to push the Small Business Administration and the Treasury Department to ensure that all of our tribally owned enterprises could access the Paycheck Protection Program, because that was not the case at the beginning, and that was unacceptable. Just like not getting the $8 billion out as soon as possible was unacceptable.
Is it surprising to you that once again, Native Americans are having to struggle to get this money, having to apply for these grants, having to go through all of this red tape?
No, I think that one of the things that we're seeing, and I saw it before I got to Congress, and I'm seeing it now, is that lack of understanding has really, in a lot of ways, exacerbated some of the longstanding issues that we've seen in terms of access to resources, in terms of access to things like running water or infrastructure, that, it's for the guidelines that are being put out there by public health professionals to wash your hands for at least 20 seconds. That's a really hard thing to do when there's not running water in your community. And I think that this pandemic has really shone a light. And I have been heartened by the number of people who have expressed interest and are now learning about these issues, that really one of the reasons that Indian country and Native communities have not gotten the resources that the federal government has a responsibility to provide is because of, in some ways, the invisibility of the voices. That's why I think it's really important for us to have more Native voices in Congress, and also in all parts of the federal government. And I think that right now we're seeing, unfortunately, the exacerbation of those issues. I wish I could say that I was, I'm shocked, but maybe not surprised.
All right. Now, you also called for an investigation into the data breach when the tribes were applying for the $8 billion in the CARES Act. Where does that stand now?
I think that, first of all, the responsibility of the federal government to maintain the privacy of all individuals who are doing business with the federal government is paramount. And to see a data breach of our tribal interests was again shocking to me, and I think that pulling together and really holding the administration's feet to the fire about the ways that they're addressing these issues it is more important. In a lot of ways, it feels like it's more important now than ever, particularly when the folks who that are seeing these impacts are the ones who are fighting for the resources for our tribal communities. And, I think that right now, I don't have any major updates around what that looks like, but I would love to come back and talk to you when we do have some updates.
All right. Now, you serve on the Transportation and Infrastructure Committee in the House. What kind of impact will your work have on Indian country when it comes to, transportation? I mean, that's a huge issue. And then also infrastructure, because what we're also seeing in so many cases is that lack of infrastructure that's impeding healthcare, it's impeding education, it's impeding a lot of things when it comes to our tribal lands.
Yeah, well, I'm glad you asked about this because one of the things that I have felt so fortunate to be able to advocate for is the tribal transportation and infrastructure needs. Serving on that committee has, I think, has had already an impact on the resources that we're going to see in Indian country around our infrastructure and transportation needs. I say that in part because the T&I committee, or Transportation and Infrastructure Committee, hadn't held a hearing related to the transportation needs and infrastructure needs of Indian country as a committee in decades, somewhere like 30 years or something like that. And
Indian country knows that.
Yeah, and we held one. You know, I advocated for that. I pushed for that, and the chairman of the committee, and I have had lots of conversations about the needs of Indian country. I cannot overstate the importance of having folks who, you know, have Deb Haaland and I being able to talk to members of Congress as their peer and say, this is important. Let me tell you why. Let me tell you about the federal trust responsibility. Let me talk to you about sovereign tribal governments. Has, I think, had a big impact already. But of course, there's always going to be more work to do. We're trying to make sure that in the Surface Transportation Reauthorization Act, which we're working on right now, there are tribal infrastructure needs in there. We're talking about road programs. We're talking about making sure that, you know, when ambulances can't get to someone because the road has not been, not even graveled, then there's issues there. And we're trying to address those. Also in the Water Resources Development Act, or WRDA is what it's called sometimes. That bill, I'm advocating for access to water, access to wastewater. Those are the kinds of things that we're making sure are included for Indian country in those bills too. It's been, you know, it's been eye-opening to see how often people will start to care about these issues once they've learned about them. I always say that people that are uninformed about the issues facing Native communities, it's not that they don't care, it's that they don't know. And we now have the opportunity to educate our colleagues about these things. And from what I've seen, my colleagues are interested in learning and interested in supporting issues that are facing Indian country.
Okay, now you are a freshman lawmaker. You sit on the Emergency Management Committee as well. How busy are you with that committee now? Yeah,
so I have been, I feel like very fortunate to be on the Transportation and Infrastructure Committee. Has jurisdiction over the emergency management, FEMA, and so I sit on that subcommittee, and it has been eye-opening to see the amount of work that we have to do to get not just the emergency management piece of it down, but also to coordinate, to make sure that you know, we've got tribal governments that are directly working with FEMA to make sure that some of the supplies that are getting out there, and the coordination of things like making sure that tribes can access the National Strategic Stockpile of medical supplies. That was something that we had to push for and fight for. You know, every single committee in some way, it seems, touches on native issues and tribal issues.
Sure.
But yes, the emergency management portion of this has been very busy.
Now you said, I believe you said that Kansas ranks 50th in this in when it comes to states. in receiving medical supplies. So it sounds like it's right in the same boat as Indian country when it comes to getting a proper PPE. But you started an effort to create this PPE.
Yeah, so one of the things that we've started to work on is trying to figure out where are those places that we can get pieces of legislation pulled together to help produce personal protective equipment. And it's exactly for the reasons that you were just saying. You know, when I talk to tribal leaders and folks in Native communities, and I'm talking to the people here in the 3rd District in Kansas, this issue of access to personal protective equipment is, I mean, it's staggering. And so, you know, I just introduced a bill called the Supplies Act, which is aimed at shoring up the personal protective equipment and making sure that companies that are able, that are here domestically are able to produce personal protective equipment. And this would provide funding to help them shift over to produce those things. I think that we're seeing a lot of companies that are coming forward and saying, I could produce this. There's actually some tribally owned companies that I know are out there that probably could shift over. And one of the things that we need to do is make sure that we've got resources in place to speed that process up. Because there are 2 things that are going to really help slow this down in terms of supplies. That's personal protective equipment and making sure that we've got testing supplies out there. So access to testing has been it's been one of the reasons that our tribal communities have been hit so hard. I know you know, the folks out to Navajo Reservation have been saying we need personal protective equipment, we need testing, and they're not the only ones. I've heard from a lot of tribes all over the country that have said we've been fighting to get testing, and you know, I voted not that long ago to get $25 billion toward a national testing strategy. And that national testing strategy absolutely has to include Indian country and Native communities in there.
And then along with that, the actual labs to process those tests, because that's been another missing link there. You held a town hall for kids that I really enjoyed watching. How did that come about? And were you surprised at the questions?
I'm so glad you watched that. And it was really fun. Yeah, I wasn't, I guess, surprised about the questions that the kids asked. You know, I think that a lot of times, one of the reasons that we wanted to do that is because, you know, all of us, our lives have been impacted significantly by this pandemic. Even the people who are still, you know, doing work. My mom goes to work every day still at the post office. You know, that's a stressful thing for folks who are still out there going to work because they're considered an essential person and have the kind of job that they can't do remotely. But also our kids have been really impacted, whether it's their parents are home all the time now, or that you know, that they are having a hard time adjusting to virtual schooling. And we wanted to do a town hall that was geared toward listening to the concerns of our youngest constituents. And I thought it was really interesting because a number of the kids asked about how they could help other people. And if that doesn't give people hope, you know, I mean, our kids are also feeling stressed, and a bunch of them are wondering, how do I help nurses? Or how do I help people who are working at the grocery stores know that we value them? I mean, it was really great town hall.
Maybe we can work with you on doing a town hall for kids in Indian country as well.
I would love that. I love that.
So you have you're a mixed martial arts athlete, And how are you staying healthy and exercising in this pandemic?
There's a couple of things. One, in the mornings when I get up, I do a little bit of moving around. It looks a little different each day, but it's things like burpees and squats and push-ups and those kinds of things. And then I have a new little dog. My partner and I decided we said we were going to foster. That lasted about 12 hours. We've adopted this dog. Her name is Nala, and going for walks is a really great way to just to move around.
Well, Congresswoman Davids, we want to thank you for joining us, and we want to wish you a happy birthday. May 22nd is your birthday, right?
Well, thank you. Yes.
How are you going to spend that?
I'm not sure yet. I'm not sure. Maybe we should do a virtual thing.
All right. Well, thank you. We appreciate your time here today.
Thank you.
All right. And thank you for watching us. Again, we air our newscast weekdays at 4 p.m. Eastern Time, and we invite you to join us and also go to our platform and watch past newscasts from Indian country today. Take care of yourselves. Your life is precious. I'm Patty Thalahungva. Thanks for joining us.